Hi, I'm Kathleen O'Connell and the presenter of this talk. I'd like to acknowledge my co-author, Joanne Wise, who managed most of the data analysis for this study. I first became interested in urinary incontinence when I heard many years ago Carolyn Samsell give a talk in which she mentioned key in the lock incontinence. My psychology background told me that key in the lock incontinence was a Pavlovian response. Just like Pavlov's dog that associated a bell with food and thus salivated, human beings apparently associated arriving home in their front door with urinating, and thus a front door had the effect of causing an urge to urinate and sometimes even a bladder contraction. So I have studied women with respect to not only this cue, but a variety of urinary cues, and showed that responsiveness to urinary cues is associated with urinary incontinence. So I decided to study men this time. So another group, especially those related to the PLUS study, have shown that bladder health is affected by factors outside of the urinary tract. And I certainly agree with that. And the factors that I'm looking at in this study are urinary cues that I've talked about, toileting behaviors, and attitudes about public toilets, and some may call them phobias about them. This study investigated these factors in men who were age 50 and older. Here's what our sample looked like: 320 men. They were participated in survey panels managed by Qualtrics Research Services. I administered 4 online questionnaires: the urinary cues questionnaire I just mentioned, an adaptation of Mary Palmer's toileting behaviors questionnaire, the Shy Bladder Scale by Stephen Seufer, and the ICIS scale on urinary incontinence. So here's what our sample looked like. Average age was about 65. They were quite diverse racially and ethnically, and there was a fair amount of reporting leaking urine. About 60% leaked urine at least once a week, and 15% leaked urine daily. These were subjects who were not recruited or screened for leaking urine, but that's just how it worked out. So anyway, we were particularly interested in how our behavioral and psychological variables related to this incontinence. So, so first of all, we looked at the straight correlations between our behavioral and psychological variables and incontinence, and found that all 3 variables are highly significant, and that the correlations were substantial, especially urinary cues and toileting behavior. I should also note that shy bladder is highly related to toileting behaviors, and because of that overlap, I'm not going to deal with them anymore in this presentation. The next thing we were interested in is how these variables might relate to each other. We did a mediation analysis. So a mediation analysis is looking at the kind of how variables might relate to each other, mediators. And so what this analysis showed is that toileting behavior, in addition to being related to urinary incontinence, is also highly related to urinary cues. And then, and urinary cues are related to urinary incontinence, but the mediation analysis showed that there was a partial mediation. That is, that urinary cues mediated the relationship between toileting behavior and incontinence. This suggests that toileting behavior increases responsiveness to urinary cues, and that responsiveness to urinary cues increases incontinence. So the implications of this study are that, first of all, that the findings are very similar to those we found in women, and that we're showing that behavioral and psychological factors appear to contribute to urinary incontinence in men, at least at the correlational level, and that behavioral approaches may be important adjunctive therapy for treating incontinence in men. I'd be happy to talk to you more about this study if you stop by my poster or if you email me at this email address. Thanks.